Welcome to all my dears. Today we are discussing about the mind symptom of Arsalb. As you know, our patient is very mentally restlessness. The mental restlessness is because of the anxiety, and anxiety leads to restlessness. So always our patient will be in between anxiety and depression. Here the depression is because of fear of death. The fear of death is because the patient believes that his disease is incurable. So that is why it is useless to take medicine. So these are the main symptom of Arsalb with ulcerative colitis indication. On examination, while interrogating your patient, you know that your patient is very sensitive. The sensitiveness may be expressed by your patient as a great anxious nature, a great anxiousness and restlessness, and at the same time your patient will have a suicidal tendency. While elaborating the mental symptom, patient wants to commit suicide, like as in case of Arsalb. It is not much severe, but patient is having suicidal tendency, and there is great hallucinations, great fear of death. That is why patient will not take medicines. So that means he thinks that it is incurable. Then great fear of death. Then about the irritability. Then anguish nature. Patient is very anguished. Then suicidal tendency. Then hallucination. Hallucination means imagination. Actually, such issues are not there, but patient feels that. Hallucination of visual, that means visual hallucination. Patient seems something like that, fearful object or ghost, something like that. Visual hallucination, or some smell, or olfactory hallucination. So delusions and hallucination. Hallucination is very predominant, and on knowing our patient is very selfish patient. He is very fastidious, he is very selfish, and at the same time our patient is very fearful, fretful, timid. That is why our patient is not having any courage, lack of courage. And there may be great weakness along with the fear, and that may be disproportionately more than the actual problem of our patient. That's why I am saying our patient will be usually always in between a condition or a mixture of depression and anxiety. Along with the GIT problem, fear of disease and death, and along with the sudden chilliness, that is a great important characteristic of Arsalb patient. Sudden chilliness is a great indication of Arsalb patient. And next, about the ailments or adaptability, I think that can be studied in next class. Thank you.